Hello, my name is Richard Stubbs. I am the Chief Executive of the Yorkshire and Humber Academic Health Science Network, and I'm also the Vice Chair of the AHSN Network, which is the national body that oversees the work of all 15 AHSNs across England. Academic Health Science Networks are here primarily to support the spread and adoption of health innovation rapidly and at scale throughout the NHS. We do that to rapidly change the way that we can deliver care for our patients, and also we do that to support the development of economic growth from within the UK by growing the innovation sector and creating high value jobs for our region. I'm really sorry that I can't be with you today, and thank you for giving me the opportunity to talk to you about this topic. I'm actually really always delighted to talk about my personal passion and mission to increase diversity within our R&D and innovation spaces. But that is especially true during Black History Month. And as I'm sure you are all aware, the theme for Black History Month this year is Proud to Be. I am really proud to be a Chief Executive of an AHSN. I am quite biased, but I do think it's one of the best jobs in the NHS. But I'm also proud to be the chair of the steering group of the NHS Confederation's BME Leadership Network. And that's a network that's there to support and elevate the voices of our ethnic minority leaders in the NHS at all levels. So please do look us up on the NHS Confederation website. And if you're interested, join as an ethnic minority leader or as an ally. And I look forward to seeing you in network meetings in the future. So what I want to talk to you about today is something that I'm really proud to have originated a few years ago. The origin story to this work is really, I think, rooted in the fact that I've been in the NHS now for far more years than I care to remember, and throughout that time have always been involved in equality, diversity and inclusion issues. I think in the NHS we often tend to focus quite rightly on the representation within our frontline staff, and then also our leadership levels and Roger Klein's snowy white peaks. But after being in the innovation role in various different organisations for about 10 years, I started to realise that actually I personally hadn't put those two agendas together, and that I didn't see anybody really doing any work on what the importance of greater diversity within our R&D sectors looks like and our innovation spaces, and why the business case to that could be quite important to the way that we deliver patient care. So I started to do some work on that, and I started to read and to write about what that business case potentially looked like, but also started to think very long and deep about the gatekeeping role that is often played by people who sit in the innovation or improvement space. It's gatekeeping in terms of the types of people who traditionally go into those roles. It's gatekeeping in terms of acceptance onto programs such as our NHS National Innovation Accelerator program, but it's also gatekeeping in terms of selecting and prioritising the kinds of demands and the kinds of needs that the NHS is seeking to identify. So what are the challenges that we set ourselves in our innovation and improvement spaces? What are the challenges set by our colleagues in the National Institute for Health Research, perhaps? And are we confident that we have a diversity of thought, both within those roles, but also within the way that those roles and those programs are influenced, that's going to ensure that the efforts and the resources that we put into how we create changes for the future are going to be changes that are going to improve the lives for all our populations and increasingly seek to reduce and not widen health inequalities. And that business case is really clear. We probably all know that almost 20% of the staff within the NHS identify as ethnic minority. What I'm really fond of saying is that, simply put, if we don't ensure that every member of the staff within the NHS has the ability to access the innovation pipeline, has the ability to bring their ideas forward in a way that's not just going to create change in their locality, but going to lift that idea to something which can be deployed at national level, then the NHS is quite simply turning its back on 1/5 of the potential ideas that have the capacity to transform the way that we deliver care. We also know, and this isn't specific to healthcare, but that any team with a diversity, any team where a member of that team shares an ethnicity with a particular client or customer, or in our case, patient, the entire team is 152% more likely to understand that client or that patient. So the evidence is out there. It's really obvious that diversity within teams, diversity of thought, leads to much better outcomes. It leads to much better experience. I think we all know this. The mission that I've taken on is to think, how can I apply that knowledge to my world of innovation, technology, working with industry, and seeking to bring game-changing improvements into the NHS. And I thought it was really important that before I did anything, we had to start with ourselves. So as AHSNs, I was really proud that every board of every AHSN in the country committed to deliver some pledges that we created ourselves to hold ourselves to account for the way that we identify and nurture innovation and the innovators behind them, both inside and outside the NHS. So this is about how we ensure that we are exemplar organisations. It's about how we ensure that we're exemplar employers. But perhaps most crucially, it's about how we look again at the work that we do with fresh eyes and start to identify where we are helping on this agenda and where we are hindering this agenda, and what actions we need to take in order to be able to improve that. And we've had the pledges in place now for just over 12 months. We've already seen huge changes and improvements in the outcomes that we're delivering. We've seen improvements in the representation and the applications to big flagship programs like our NHS Innovation Accelerator and other things. And I'll be publishing a report early next year which just sets out some of our early findings from the work of adopting these pledges. And I'm really blessed to be joined across the entire network by colleagues who have come together to help me to deliver this agenda. So what we have now is a really mobile and energized team who come together to support each other to deliver our pledges, but also I think crucially to think about how we can really start to promote and embed the concept of why greater diversity innovation is so important to our patients. And I think particularly thinking about COVID-19 and the stark health inequalities that were shown, I think we have an even greater role to play, especially I think around digital and making sure that anything we do around digital technologies seeks to reduce and not widen health inequalities. And when it comes to digital inclusion, I think that's a really, really crucial thing to always keep in mind. The other thing we want to do, and I think this is so important, and speaking as an ethnic minority NHS leader, this is crucial to me. We have to be able to champion and find role models. And I think that's particularly true in our innovator community. I very deliberately spent a lot of time in the first year of this work really identifying and lifting and platforming and championing some amazing innovators from BAME backgrounds. Innovators who are from within the NHS and from health and care wider, but also from industry as well. But talking about their personal experiences, their heritage and their journeys and how it's all shaped their work and their outlook, and crucially, their innovations. I think there's something about the lived experience of these innovators, which almost by default bakes in elements to their work, which seeks to make sure that they're engaging with all communities. It seeks to make sure that their work helps to reduce and not widen health inequalities. And I think for me, that's part of the business case about why this is so important. And if you download our report, you'll see stories from all these innovators talking about why that's important to them and how their journeys have influenced their decision making and their roles as innovators, both inside and outside the system. But I'm not stopping there. So we've done some great work over the last 12 months. I think I'm pretty confident in saying the AHSN network really owns and understands this space and is committed to delivering our pledges over the long term. But now that we've, I suppose, looked at ourselves quite in a focused manner, I'm now thinking about what's next. And so I'm working with the wider health and life science industry. So people like the Association of British Pharmaceutical Industries, the Association of British Health Tech Industries. Basically our entire life science, pharma, medtech, digital and diagnostics communities and large companies to say, if we think about what Lewis Hamilton is doing in Formula One around his Mission 44, which is how how does he start to champion groups from underrepresented communities who aren't yet currently working in science, engineering, and particularly in the Formula One supply chain? What would it look like if we started to create something that we did together and led together that was of the same goal? So I'm using Mission 44, Lewis's work, as my inspiration to start to have a conversation nationally about what our health and life science sector would achieve if we created that same ambition together. And you'll hopefully see the QR code on the screen. There's a link to a Microsoft Forms, or you can just email me. But I'm really keen to have that conversation with people, to bring everyone together under one umbrella, to say we're all working in this space individually. If we all put our efforts together as well, what could we create in terms of transforming the way that access to roles, senior roles within innovation and improvement are created, but also that we start to really recognise what the lived experience of people from diverse backgrounds brings to transformation if we really open that door as wide as possible. So thank you very much for listening. Again, I'm so sorry I can't be there with you live today, but hopefully if any of this has piqued your interest, do look at our work. The website address is there. Follow the hashtag AHSN Diversity to see some of the examples of what we're doing on Twitter. And as always, if anybody wants to talk about this in more detail, please do get in touch. Enjoy the rest of your day. Bye-bye.